Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. And today, Irina and I are going to have a little discussion about general questions you might ask your internist.
How can I best manage chronic condition like diabetes or high blood pressure?
Well, of course, first and foremost, as the saying goes, an ounce of prevention is worth a pound of cure. You can avoid diabetes from developing even in people who have a family history and a propensity for it through making sure the lifestyle is as finely tuned and good as possible with diet, nutrition, exercise, proper sleep, managing stress, etc., no risky substances and so on, then great. But if somebody comes to me and they already have a diagnosis of diabetes, which we typically make with the hemoglobin A1C blood test. So an A1C from 5.7 to 6.4 is considered prediabetes, 6.5 and above frank diabetes. And I've had patients come to me with A1Cs that are actually off the chart. It just said greater than 15%. The laboratory couldn't measure it. Who are now actually, without medication, have a reasonably well-controlled A1C for somebody with diabetes, meaning it's under 7%. That's what the guidelines are from the Diabetes Association. For somebody with diabetes, you'd like them to have an A1C under 7%. So it can be done. Sometimes I get there with a little bit of insulin for somebody who comes really uncontrolled, like that particular patient that I'm referring to. Sometimes we can do it with a GLP-1 or GLP-1 GIP agonist. So here I'm talking about things like Ozempic and Mounjaro. Sometimes we can do it with a little bit of metformin. Sometimes, particularly in young patients, we can clean up the lifestyle, maybe use a little bit of medicine very briefly, and pretty much get them back to being insulin sensitive instead of insulin resistant because they're relatively young and the pancreas still has a lot of reserve for making insulin. So it depends. But first and foremost, the foundation will always be the proper lifestyle, and then we'll use medicine if we need to. It might be only temporary. It might be longer term. It all depends. It depends if we have other things to manage too, like obesity, for example.
And how often do you need to see your internist?
Well, it really depends on your health. Let's say you're a healthy 22-year-old person with no real medical problems. You should be seen once a year for annual physical, blood work. If you want to be really aggressive, you could think about the Gallery blood test we do for screening for cancer in the blood, not leukemia, cancer markers in the blood, or whole body MRI. But, if you're young and healthy, once a year, regular routine lab work. But if you have multiple medical problems, it all depends on how they need to be managed. If you have blood pressure but it's well controlled, I might want to see you every 3 months. If we're working on weight together, it usually is in our clinic once per month, and maybe working with health coach, exercise physiologist in between up to once a week. So it all depends on what's happening with that particular patient.
Thank you. That was very informative.
My pleasure. So, of course, if you'd like to learn more about what we offer in terms of concierge-style, internal medicine, as well as weight management, remember I am boarded in both of them. You can call the office, 516-604-3418. Find us online at northeastmedicalpractice.com. Visit our social media channels that you're probably already looking at right now, our YouTube channel, or you can watch and listen to me interview other doctors as well as just talk on my own regarding health optimization topics on my podcast called Longevity MD on Spotify. As always, everything that we share on these podcasts and videos are for informational purposes only and do not constitute medical advice. No doctor-patient relationship has been formed in this context. And if you have questions, concerns, please don't hesitate to reach out to your own medical professionals. But until we see each other next time, be in good health.